All the information that we will share to you in this video that all collected from legal sources and through the top doctors of the world. What is trichinosis? Trichinellosis, also called trichinosis, is caused by eating raw or undercooked meat of animals infected with the larvae of a species of worm called Trichinella. Infection occurs commonly in certain wild carnivorous, meat-eating, animals such as bear or cougar, or omnivorous, meat and plant-eating, animals such as domestic pigs or wild boar. What are the signs and symptoms of a trichinosis infection? The signs, symptoms, severity and duration of trichinosis vary. Nausea, diarrhea, vomiting, fatigue, fever, and abdominal discomfort are often the first symptoms of trichinosis. Headaches, fevers, chills, cough, swelling of the face and eyes, aching joints and muscle pains, itchy skin, diarrhea, or constipation may follow the first symptoms. If the infection is heavy, patients may experience difficulty coordinating movements, and have heart and breathing problems. In severe cases, death can occur. For mild to moderate infections, most symptoms subside within a few months. Fatigue, weakness, muscle pain, and diarrhea may last for months. How soon after infection will symptoms appear? Abdominal symptoms can occur 1-2 days after infection. Further symptoms usually start 2 to 8 weeks after eating contaminated meat. Symptoms may range from very mild to severe and relate to the number of infectious worms consumed in meat. Often, mild cases of trichinosis are never specifically diagnosed and are assumed to be the flu or other common illnesses. How does infection occur in humans and animals? When a human or animal eats meat that contains infective trichinocysts, the acid in the stomach dissolves the hard covering of the cyst and releases the worms. The worms pass into the small intestine and, in 1-2 days, become mature. After mating, adult females lay eggs. Eggs develop into immature worms, travel through the arteries, and are transported to muscles. Within the muscles, the worms curl into a ball and cyst, become enclosed in a capsule. The life cycle repeats when meat containing these encysted worms is consumed by another human or animal. Am I at risk for trichinosis? If you eat raw or undercooked meats, particularly bear, pork, wild feline, such as a cougar, fox, dog, wolf, horse, seal, or walrus, you are at risk for trichinosis. Can I spread trichinosis to others? No. Infection can only occur by eating raw or undercooked meat containing Trichinella worms. What should I do if I think I have trichinosis? See your healthcare provider who can order tests and treat symptoms of trichinosis infection. If you have eaten raw or undercooked meat, you should tell your healthcare provider. How is trichinosis infection diagnosed? A blood test or muscle biopsy can show if you have trichinosis. How is trichinosis infection treated? Several safe and effective prescription drugs are available to treat trichinosis. Treatment should begin as soon as possible and the decision to treat is based upon symptoms, exposure to raw or undercooked meat, and laboratory test results. Is trichinosis common in the United States? Infection used to be more common and was usually caused by ingestion of undercooked pork. However, infection is now relatively rare. During 2008 to 2012, 15 cases were reported per year on average. The number of cases decreased beginning in the mid-20th century because of legislation prohibiting the feeding of raw meat garbage to hogs, commercial and home freezing of pork, and the public awareness of the danger of eating raw or undercooked pork products. cases are less commonly associated with pork products and more often associated with eating raw or undercooked wild game meats. How can I prevent trichinosis? The best way to prevent trichinosis is to cook meat to safe temperatures. A food thermometer should be used to measure the internal temperature of cooked meat. Do not sample meat until it is cooked. USDA recommends the following for meat preparation. For whole cuts of meat, excluding poultry and wild game. Cook to at least 145 degrees Fahrenheit, 63 degrees Celsius, as measured with a food thermometer placed in the thickest part of the meat, then allow the meat to rest for 3 minutes before carving or consuming. For ground meat, excluding poultry and wild game. Cook to at least 160 degrees Fahrenheit, 71 degrees Celsius. Ground meats do not require a rest time. For wild game, whole cuts and ground. Cook to at least 160 degrees Fahrenheit, 71 degrees Celsius. For all poultry, whole cuts and ground. Curing, salting, drying, smoking, or microwaving meat alone does not consistently kill infective worms. Homemade jerky and sausage were the cause of many cases of trichinosis reported to CDC in recent years. Freeze pork less than 6 inches thick for 20 days at 5 degrees Fahrenheit, -15 degrees Celsius, to kill any worms. Freezing wild game meats, unlike freezing pork products, may not effectively kill all worms because some worm species that infect wild game animals are freeze-resistant. Clean meat grinders thoroughly after each use. To help. Thanks for watching. Like it, share it with your friends and family. To make sure you will get our upcoming videos then. Subscribe now our channel by clicking here.